A year after the COVID-19 virus first was introduced from Wuhan, China, we are now living in a world that is completely infected with this virus with no known cure. Tonight on Eye of the World, we are going to visit professors and doctors and researchers from all corners of the globe to hear their thoughts on this pandemic and to put into perspective what each country is facing in this devastating time. We thank you for joining us tonight on Eye of the World. My name is Christina York. First, we're going to go live to Paris, where we have Dr. Halley. She is the founder and CEO of Advancing Health Equity, an emergency medicine physician working on the front lines of the COVID-19 pandemic at an urgent care center in Paris. Dr. Halley, what can you tell us about the situation in Paris at this time?
Hello everyone, I am Halia, doctor from France. Today I will give you information about the epidemic process of France. The first case of the COVID-19 outbreak was seen in the city of Bordeaux on January 24. On January 28, the 80-year-old Chinese tourist was tested positive for COVID. On February 14, the Chinese tourist died after being hospitalized in Paris. This, along with France, was the first death to be recorded from COVID-19 in Europe and the first death outside Asia. On 12 March, French President Macron announced that all schools and universities would be closed from Monday, March 16 until the next declaration. The next day, more than 100 people were banned from gathering, including public transport, and public places such as restaurants, cafes, and cinemas were closed in the following days. France saw the lowest death rate since March 22. The 2-month curfew ended France on Monday, May 11, and the first normalization process began. Primary schools and some businesses were opened. The second normalization process started in June. It was announced that the schools would be fully opened completely on 22 June. Vaccination in France started on 27 December. In the first place, the elderly, nursing homes residents, healthcare professionals, and teachers will be vaccinated. French President Macron announced that the vaccine is not mandatory and that the vaccine available in Germany will be used. As for December 29, there were 2,574,041 confirmed cases, while in France, 190,806 people recovered, 64,078 patients died from the virus. I have come to the end of my speech. Thank you for listening to me.
And now we will go to Germany, where we will speak with Serge, the head of the German Public Health Institute, who directs the Institute of Virology at the Charité Hospital in Berlin.
Hello, I'm Professor Dr. Anna Hosa Scheiter. First of all, I want to talk about the importance of the new measures taken since December 16 due to the increase in the number of cases recently. As you know, the first case was on January 27 and the first death was on March 11. Since that day, we take strict measures and expect our citizens to comply with these measures and reduce the risk of transmission. Today, we detected more than 19,000 new cases and we lost 1,022 people due to coronavirus. The total number of cases to date has reached 1,900,000 and the number of deaths has approached 34,000. As you can see, case and death rates are on the rise in Germany. You will make a great contribution to these measures and restrictions, hygiene and social distance rules. In addition, we start the first vaccination on December 27. First of all, we plan to vaccinate citizens aged 80 and over to staying in nursing homes and 1 million healthcare workers. Thanks to vaccination, we want to return to normal life until the winter months of 2021, and I believe we can achieve this together. Thank you. Let's not forget the mask, distance, and hygiene.
Okay, thank you very much for that. Now, we're going to go now to Wuhan, the ground zero of this terrible virus. And we're going to speak with Azra, who is the founder and director of the Wuhan Research Translational Institute and professor of molecular medicine at the Wuhan Research Institute.
Have a nice day. I'm Azra from China. I want to start by explaining how quickly we got through the pandemic process. The most important thing for me is that the government applied strict measures and the people followed these restrictions unquestioningly. We got through the process very well. The first case appeared in late 2019. The virus was spreading very quickly and there was no room left in hospitals. For this reason, a new hospital was built in 10 days. As I mentioned before, the measures increased and our people followed the measures and we managed to minimize the number of cases in such a short time. And there are almost no cases compared to the present population. Our work on the vaccine is still continuing. Our goal is to provide nearly 100% protection. Finally, let's not forget that if we follow the precautions, we can delete this virus from the world and make it a thing of the past, I believe. I repeat things we already know. Please put on your mask and stay at home as much as possible. Wash your hands for at least 20 seconds and stay away from crowded places, even if they are your family, and never lose hope. I wish you all a good day.
Let's talk with our special guest tonight, Dr. Esma. Dr. Esma is the professor and chair of medical microbiology and immunology at the Hacettepe University. Dr. Esma?
Hi, I'm Professor Esma. I want to give information about the cases in Turkey. The first case was identified on March the 11th in Turkey. At the first death occurred on March the 18th. At the first, everything was under control in Turkey. Experiencing some negative situations in the ongoing progress brought on some measures. And right now we have things to watch out for. One of them is isolation. Currently, isolation is very important. Masks, social distance, and hygiene have become a part of our lives day by day. Coronavirus is very dangerous. 158,103 tests have been done today. The number of active cases is 12,203. The number of serious or critical patients is 1,908. 212 people have died. The good news is that 14,110 people have recovered. Many measures were taken to prevent the increase at this number. I want to talk about this. One of the measures taken was closing schools. Schools have been closed for nearly a year. School closure did not prevent education. The school is not just a wall on four sides. Everywhere is school if there is any education. Our home is like our school. Thermometer survey was imposed. Restrictions were applied to certain age ranges. Going to public places was prohibited. Due to the decrease in cases, some restrictions were realized. The coronavirus affected many things. Some students could not get education because they lacked necessary technological devices or the internet connection. Many workers get unemployed. These students who could not receive education were supplied. Technological devices such as tablets, besides who get unemployed, were supported negatively. If we would like to fix everything, we must obey the rules. I want to talk a little about the vaccine. The vaccine, which has been tried to be made for about 1 year, has become ready for use, and Turkey has ordered 50 million doses of vaccine from abroad. The vaccine will be applied in your country soon. Turkey's scientists will live in Germany, develop this vaccine. We can defeat the coronavirus together. Thank you for listening.
Now let's hear from Ada. Ada is an Indian Research Fellow and Team Lead for Coronavirus Research in the Viral Pathogenesis Laboratory of the Vaccine Research Center at the National Institute of Allergy and Infectious Diseases, and this is part of the National Institutes of Health.
Hello everyone, I'm an Indian doctor and my name is Edanur. Today I will talk about India coronavirus period. The first case of COVID-19 in India, which originated from China, was reported on 30th of January 2020. India currently has the largest number of confirmed cases in Asia and has the second highest number of confirmed cases in the world after the United States, with more than 9 million reported cases of COVID-19 infection and more than 100,000 deaths. The per-day cases peaked mid-September in India with over 90,000 cases reported per day and have since come down to below 40,000 in December. On 22nd of March, India observed a 14-hour voluntary public curfew at the insistence of Prime Minister Narendra Modi. It was followed by mandatory lockdowns in COVID-19 hotspots and all major cities. Further, on 24th of March, the Prime Minister ordered a nationwide lockdown for 21 days, affecting the entire 1.3 billion population of India. On 14th of April, India extended the nationwide lockdown till 3rd May, which was followed by 2-week extensions starting 3rd and 17th May with substantial relaxations. From 1st June, the government started unlocking the country in 3 unlock phases. In July 2020, India's Ministry of Information and Broadcasting claimed the country's case fatality rate was among the lowest in the world at 2.41% and steadily declining by mid-May 2020. 6 cities accounted for around half of all the reported cases in the country: Mumbai, Delhi, Ahmedabad, Chennai, Pune, and Kolkata. As of 10th of September 2020, Lakshadweep is the only region which has not reported a case. On 10th of June, India's recoveries exceeded active cases for the first time. Infection rates started to drop significantly in September, and the number of daily new cases and active cases started to decline rapidly. A government panel on COVID-19 announced in October that the pandemic had peaked in India and may come under control by February 2021. India has over 30 anti-COVID vaccines in various stages of development, and the first of these is expected to be introduced in early 2021. The pandemic has left a severe impact on Indian economy, leading to a negative growth rate for the first time in decades. Nevertheless, the economy started to rebound after the lockdown was eased. Increased requirements for consumption had led to government and private firms to repurpose their factories and production lines for manufacturing of more hospital beds, PPE, and ventilators. India emerged as the world's second largest manufacturer of PPE during the pandemic. The Union government also launched a major self-sufficiency campaign to substitute imported products with domestically produced counterparts, especially to replace goods imported from China. Government of India is taking all necessary steps to ensure that we are prepared well to face the challenge and threat posed by the growing pandemic of COVID-19, the coronavirus. With active support of the people of India, we have been able to contain the spread of the virus in our country. The most important factor is preventing the spread of the virus locally is to empower the citizens with the right information and taking precautions
as per the advisories being issued by Ministry of Health and Family Welfare. Thanks for listening to me.
Okay, thank you very much. Now, we're speaking with Dr. Reyna tonight as well. Dr. Reyna is the medical director of the Special Pathogens Unit at Boston Medical Center, and she's also an associate professor at the Boston University School of Medicine.
Greetings. I'm the U.S. Health Minister Rana Martinez, also a member of World Health Organization. Today, I just want to talk about what's happening in the U.S. As you know, the US is a crowded country. That's why the number of total cases is high. We should work harder than the other countries to take the virus under control. We are taking serious steps. Our states are calm now. We closed down the schools. That's the first precaution we took. In order not to aggravate anyone, we handed out electronic devices across the country. We tried to ensure equality in education. We supported positive cases and unemployed people. We reduced taxes for them. Also, we supported our health workers. This virus caught us off guard too. We realized that we can't take care enough patients. Our health workers overworked. Our economy wasn't enough for a short time. Then we fixed it. We increased the number of respectful citizens in our country. So case progress has slowed down. The number of deaths is high due to old population. Everyone was so brave. Everyone is still brave. The American citizens are braver than the other ones. They kept the communication between them. It's been a long time since I saw them coordinated. Of course, citizens weren't the only people who were working. Our scientists worked hard too. We tried to give them all the support we could. Thank you all of them for the vaccines we have. Let's talk more scientific. We have total 18 million cases now. 327,000 citizens has died, but 11 million citizens won this fight. I believe we can defeat this virus as soon as possible. The Americans will develop the real vaccine, and we will show everyone that we are the world leader again. Together, we will defeat this virus that was detected for the first time on January 19, 2020. Thanks for listening. Don't forget to put on your mask.
That's fantastic. Now, we're going to head to Italy where we have Dr. Zeynep online. Zeynep is an infectious diseases researcher and science communicator and associate editor for clinical microbiology and infection in Italy.
Hello, I am Zeynep from Italy. The virus was first confirmed to have spread to Italy on 31st January 2020. Then the first death is on 22nd February. By the beginning of March, the virus has spread to all regions of Italy. On 31st January, the Italian government suspended all flights to and from China and declared a state of emergency. 21st March, the Italian government closed all non-essential businesses and industries and restricted movement of people. In May, many restrictions are gradually eased, and on 3rd June, freedom of movement across regions and other Europe countries was restored. And now, total cases are approximately 2 million, total deaths are approximately 70,000, and fatality rate is 3.5% in Italy. Thanks.
And finally, tonight we go to the UK where a new strand of this virus has been reported. It has started there. It is now also showing up in other parts of the world. Please welcome Dr. Arzu. Dr. Arzu is the Undersecretary of the Ministry of Health of the UK. Thank you, Dr. Arzu.
Hi, UK Undersecretary of the Ministry of Health, Professor Dr. Arzu. I will tell you about England's fight against coronavirus. The COVID-19 pandemic was first confirmed to have spread to England, with 2 cases among Chinese nationals staying in a hotel in York on 31 January 2020. The 2 main public bodies responsible for health in England are NHS and Public Health England. The Department of Health and Social Care for England launched a public health information campaign to help slow the virus's spread and began posting daily updates in early February. The HSC began testing for COVID-19 during February 2020. Also, in February, the Health Secretary met Hong Kong, introduced the Health Protection Regulations 2020 for England, and hospital set up drive-through screening. In March, the UK government imposed a stay-at-home order. Dubbed Stay Home Protect the NHS, Save Lives, banning all non-essential travel and closing most gathering places. Those with symptoms and their household were told to self-isolate, while those with certain illnesses were told to shield themselves. People were told to keep apart in public. Police were empowered to enforce the measures anti-coronavirus Act 2020 gave all four governments emergency powers not used since the Second World War. In late April, Prime Minister Boris Johnson said that the UK had passed the peak of its outbreak. Daily cases and deaths slowly declined in May and June, and continued at a relatively low level in July and August. In December, the UK became the first country to authorize and begin use of the Tonsinamyran vaccine.
I'd really like to thank each and every one of you again for joining us this evening, giving us your views on the pandemic in your individual countries. Your points of view are so very important to all of us here. And reporting for Eye of the World, this is Christina York from Canada, wishing you all to stay safe, stay home, and keep fighting. Good night.